Hi everyone, we're talking about the history of PBMT today, so let's get straight into it. Our learning outcome is to explain the history of PBMT in health and medicine. This is really important for you to know, one, because it's really interesting, but also knowing the roots is really important to being able to start saying, okay, well, this is why we're delivering it. This is the journey that it took to get here. And it was quite a big journey with getting that research together. And to provide that understanding for your patients, to get that buy-in, to make sure that they're really sold into their management plan, because you understand and know that this is going to be their best option as part of their comprehensive management plan to get them better, faster. So really back into 1916, Einstein proposed the phenomenon of stimulated emission. From there, there was quite a bit of a gap before we started going into a little bit more of, okay, well, how do we actually put this together? And then Ted Maiman invented, built and patented the world's first laser. Now this was quite a high level laser. And then we go through to 1965 where we start to get that 100 watt CO2 laser in tumour therapy. It was a disaster and caused malignancies throughout the whole of the body and through that lymph system. Now this sort of made people go back a little bit and say, oh, well, is this the best thing to be treating the body with? Now before, and as we then started going through, we then started going, okay, well, this is quite a high power laser. We can then start potentially using this in the commercial lasers, which started to come in a bit more mainstream around that 1974. The UK physios were using low-powered laser for sports injuries in 1983, and this is where we start to see some of our evidence building up, but very slowly at this stage. It wasn't until 1998 when NASA was sort of thinking, okay, we need to start knowing a little bit more about this. And particularly, when we're off the world, healing is really important, and making sure that we're keeping, astronauts in this case, at the top of their game was quite an important aspect. And so they were using PBMT for their wound healing in that aspect. 99, the US military started doing some of their nerve regeneration with PBMT. But really at this stage, we didn't know the right protocols. And so when we start looking at the evidence, the old evidences, particularly the systematic reviews and meta-analyses are saying, well, it's either here nor there, we're not getting consistent results, because it's all about getting the right protocols. And it's only more recently that we're starting to see that. And that's why we're seeing, these gaps in between a lot of what's happening, but it speeds up really quickly. From 2005, we start seeing some spinal cord regeneration being utilised, and that's just such a game-changing aspect. PBMT was published on the cover of the journal Nature, a really high impact factor journal, really started to shape how we're going to be using and perceiving PBMT into the future. 2010, we start seeing those recommendations from our peak associations in America and more recently here in Australia to use PBMT for Achilles tendinopathy as a standard treatment. And this is what we're really getting down to. Once these guidelines change and are part of sort of the landscape of health and medicine, that's when we start to say, okay, we're on the right track, making sure this research is well-rounded, we've got the right protocols, devices, and we're undertaking that with consistent good results as well. This is when those sort of recommendations and guidelines start to change. More recently, jumping ahead again, we start to see more and more systematic reviews showing use to increase muscular performance, decreasing knee arthritis pain, the carpal tunnel syndromes, and increasing those healing rates in pressure ulcers. This is sort of that time where we're starting to get all those systematic reviews, meta-analyses together that are really starting to shape, okay, these are the right protocols, and here's our larger body of evidence showing that these are the right protocols and the outcomes associated. We're starting to see, up to that sort of 60 to 70% increase in healing rates, whether it is tendon or tissue healing. And so getting those optimized dose rates was a really critical aspect around that 2016. We then jump into that, a more current era of 2018 to 2022, where we're starting to explore a little bit further about where PBMT can be used. Not only the musculoskeletal side of things, but in the psychological disorders, major depressive disorders, Alzheimer's, nerve regeneration, neuropathic pain, fibromyalgia, Parkinson's, into the bone repair in a lot more detail. But also then, with our more current themes of COVID-19, that pneumonia and the long COVID, but also into our respiratory aspects of, COPD, and exploring that greater scope of conditions that can potentially be helped with PBMT. And I start challenging you to start thinking, in our next session about, okay, well, what's actually been, or how PBMT works. And if we're seeing these downstream effects and different enzymes and proteins being activated, of course it's going to help the whole body. And so, we start then thinking, okay, well, where else could it potentially help there? Now, at current, I've done a few searches, and this is sort of around that sort of September 2022, where we're seeing more than 100 new studies per month, with 1,395 new studies in 2021. And that's during COVID. That includes RCTs, Cochrane reviews, systematic reviews, meta-analyses, and a further 11,000 plus studies are published when searching that PBMT or photobiomodulation therapy or triple LT or low-level laser therapy, which is a huge amount of resources. Now, of course, doing both of those, because that's the newer term mixed with the older term, mixed with our acronyms, is a really nice way to search. Now, when we're just searching PBMT, we've got over 5,400, and that's only in the last sort of 7-8 years that we've been using that term. And so to see that huge change in that body of research, that's basically half of what we're looking at has been in the last 7 to 8 years of all research undertaken in this area. And that's a huge upturn of research that we really need to get those dose rates perfect there. So yeah, do note that change from triple LT. But in contrast, something that's a little bit more mainstay, really commonly used throughout health and medicine, particularly allied health, is shockwave therapy. And when you put in shockwave therapy or ESWT, only 3,000 studies come up. Now that's not poor, but it is showing that we're underappreciating low-level laser therapy, PBMT, in its whole, and we need to get this research and evidence out there because it is helping in multiple conditions across the whole body in a really good way, and we do have that research there to back it up as well. Where does this become important for you? I really do think it allows you to better educate your patients and say, this isn't just a fad that's come and gone. It's something that's well researched, backed by evidence, and backed by, a huge history of, exploration into laser therapy. That enables your patient to have a little bit more confidence in you and this new technology that they may not have heard about, and that increases the trust to ensure that you get them that good outcome that is going to occur. Long history, so lots of grassroots, a lot of different people using it in different ways. There's lots of changes, and I really want to emphasize that point. The earlier research does stink, and that's because we hadn't optimized those protocols yet. But in the same way, it doesn't mean that it's not going to work, and we've now found for a lot of our conditions the best and most appropriate protocols due to that ongoing research. So do look at the more recent studies when we're looking at that. But it is a new frontier, greater understanding of how this is going to optimize our programs, our treatment programs, and then the advancing scope of conditions treated is really starting to show there. And we're going to cover that off in a little bit more detail coming up. But today, that's been history of PBMT. Thank you.